Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Okay. What are the complications of radioactive iodine therapy? Radioactive iodine therapy has complications which are divided into acute complications, and we also have long term complications. Okay, first we will see the acute complications. The patient might present with some neck pain. In radioactive iodine therapy, the patient might present with neck pain, swelling, tenderness can be seen as acute complications. In acute complications, the patient can have thyroiditis, sialadenitis are also seen. There can be hemorrhage can be seen, with brain metastasis can also be seen. Cerebral edema is also seen, especially with brain metastasis. There can be vocal cord paralysis, nausea, vomiting, and bone marrow suppression are also the acute complications of radioactive iodine. Then we have long term complications of radioactive iodine. In long term complications of radioactive iodine, here we have some hematological complications are present. So here we have some hematological complications are present. In hematological complication, the patient will have bone marrow suppression is seen. There can be bone marrow suppression with leukemia is one of the complication of radioactive iodine. So actually in radioactive iodine, the first complication is hematological complication, which is due to the radioactive iodine and sorry yeah, in the radioactive iodine therapy there is hematological complication, which is the iodine can cause depression or suppression of the bone marrow will occur. Because of bone marrow suppression, the patient can have anemia. There is decreased WBC, leukopenia, and there is decreased platelets, that is thrombocytopenia are also seen. The patient can also present with leukemia also. Then the patient can have problems in fertility. That is, the patient can have either ovarian and testicular damage can occur because of radioactive iodine. Obviously in the radioactive iodine, it is a radioactive substance, right? Whereas ovarian tissue and the testicular tissue mainly contains the germ cells. Radiation tissue, in most of the cases, it is harmful to the germ cells. So ovarian and testicular damage are common. If there is ovarian and testicular damage, obviously this will lead to infertility, and there is increased abortion rate is seen. Long term uses complications of radioactive iodine therapy include these also. So long term use of radioactive iodine, this radioactive iodine can damage the lungs, resulting in pulmonary fibrosis. They can even cause inflammation in the salivary glands, causing chronic sialadenitis, which can result in taste dysfunction. They can also result in decreased parathyroidism because of destruction of parathyroid glands. Because it is a radioactive substance, these will cause increased risk of cancers. So they can cause risk of anaplastic thyroid carcinoma, risk of gastric carcinoma, hepatocellular carcinoma, risk of lung, bladder, and breast carcinoma. All these is increased due to the usage of radioactive iodine therapy.
thank you and thank you for watching.